be surprised by how fast some people will respond.
I haven't thought about getting on asking questions on the lake.
Oh, good.
I'm sorry, we have some background talking. If you're not actually asking a question, I would suggest you press *6 until you're ready to ask the question, so we don't have that background. The other question that you had, I'm sorry, let's repeat that again.
The question was, if I'm going to take a 24-minute period to like 3 sessions, is there a benefit to putting it on 4 and then 8 and then 10? Because I could take 10 very well. Or should I just use all 3 at 10 or all 3 at 4 or all 3 at 8? Or any combination?
The answer is yes. Any combination. It depends on what your intent is. If you have individuals that tend to be sensitive to the field and they need to be ramped up slowly, their bodies, their reactions to the treatments are going to tell you how to do that. When I'm starting to move somebody up from low levels and they're particularly sensitive, particularly if you have people with generalized conditions with fairly significant neurasthenia, where their bodies have been very stressed by significant illness or stays in the hospital, or they're quite old, then what I would do is I would ramp it up gently and not use the whole period of time for the same level of therapy. Adjusting the therapy levels is particularly important at bedtime. Now, different people respond in different ways to the magnetic field. What we most of the time, what we recommend is that you use a level 1, 2, or 3 at bedtime. What I've done under certain circumstances for myself and recommend to other folks is that you use a 10 perhaps or an 8, a higher level, to treat an underlying condition. Say you have arthritis, or you want to improve the vasculature. Say it's somebody with claudication or peripheral vascular disease or Raynaud's, etc. So what you do is you can start off with a 10. And then the next treatment would be, say, a 5, and the third treatment would be a 1. So you, in a sense, ramp them down.
Oh, that's interesting. That's the first time and then you can go to sleep. Is that what you're saying?
And then you go to sleep.
Okay.
The other thing to consider, too, is that some people's bodies react to magnetic fields in a way that if you keep exposing to the same field strength, what you do is the body starts to ignore the signal. The QRS has 3 essentially static frequencies, 250, 23, and 3. So those cycles keep repeating themselves over and over and over again with a given treatment. There appears to be a perceptual difference in the body when you change the settings, the strength settings. So the body sees the signals differently depending on which signal is the strongest. It sees 250 much better at higher settings. It tends to see the 1, 2, and 3 much better at the lower settings. Their signal is the same strength, the frequencies are the same, but the way the body perceives the signal varies with the intensity. Which is why you'll see in our literature that you can use the middle ranges are used for maintenance, the lower ranges are used for psychosocial, emotional relaxation benefits, and the upper ranges tend to be used more for deeper problems, more for musculoskeletal problems. And as I mentioned to you about circulation, you get a much stronger effect on circulation with the higher field strength. So it really depends on the aim of your treatment and how adaptive the individual is, or accommodative the individual is to the field.
Thank you so much. Thank you.
Next question.
Hello?
Yes.
Yeah. I was wondering, does it have any impact on allergies? And then my other 2 questions are on multiple sclerosis and diabetes.
Allergies, MS, and diabetes. Mm-hmm. All right. Well, I mentioned the dermatoses, the dermatologic conditions that would relate to allergies. They're significantly improved. The magnetic field stimulates I'm sorry, somebody there has music in the background or TV or something. If you could press star 6 star. Even if you just ask me a question, you're going to still hear me if you press star 6 star. What it would do for allergies, it could actually enhance the immune response to allergies. One of the things we do know is that where there's a significant immune response in the body, you can temporarily have an aggravation of the immune response. And so it's possible that temporarily allergies could be aggravated until the body can heal itself. However, over long periods of time, what you're doing with the magnetic field therapies is you're strengthening the immune system, you're changing the vascular responses, you're stabilizing a lot of metabolic processes of the body, you're making the cells function in a healthier fashion. One of the things that happens with allergies is as the body begins to react to one allergy, the next one needs less stimulation to add an additional reaction from the body. So if you can stabilize the whole metabolic system of the body, the immune system of the body over time, what you would end up doing is finding that the allergic reaction should decrease. For example, we also know with asthma, magnetic field therapy over longer periods of time, even during the acute phase, magnetic field therapy can actually decrease an asthmatic attack, shorten it, make it less severe. And then if allergies or asthmatic attacks happen again, or as the breathing becomes more difficult again, regular use of the QRS tends to lower the need for medication. So you might be able to get away with lower doses, and they would have a stronger, earlier effect for you. Allergies show up in the body in many, many different ways. You can use the pillow, for example, with sinusitis. It can decrease the pain. It can help to restore tissue integrity. What I sometimes recommend to people with maxillary sinus congestion is that you treat with the pillow for 8 minutes, maybe 16 minutes, and then you hang your head over the edge of the bed. You lay it down on your belly on the bed and hang your head over the edge of the bed. Or if you're standing up at the sink, make sure that your head is down below the level of your heart. The maxillary sinus, the openings of the maxillary sinus are at the top. They're like saddlebags. And if you bend over after a magnetic therapy treatment, what it does is it drains. It'll actually drain. Your nose will start dripping. I don't know how many of you found that when you bend over to wash your face in the morning in the sink, very often your nose will start dripping. Clear stuff will just come out of your nose. Well, that's the maxillary sinus emptying itself. As long as the opening is patent, is open, then you will drain if you have anything to drain. So you do the treatment, and then you bend over and allow the sinuses to drain. Now, MS. Magnetic therapy and MS, this is an area that's currently being studied more significantly. We have found significant improvements in many, many components of MS. I think it would be remiss of me or anybody talking about magnetic therapy to lead somebody to believe that magnetic therapy is going to cure them of their MS. We still don't really understand completely what MS is caused by. People have all kinds of suppositions, and when there are many, many different people saying this causes this or that causes it or etc., then we all know that there isn't a perfect explanation for it, and nobody's got the right answer. What I think how we need to view magnetic therapy with somebody with MS is that you have to view it as a physiologic tool in helping to strengthen the body's responses. It may also, immunologically, help to decrease the episodic nature of the MS, so that repetitions of it or recurrences of it tend to be less severe, and they may last a shorter period of time. Magnetic fields increase the body's energy systems, and one of the things magnets do is they work through the acupuncture system of the body. We know that very clearly. We've looked at a device called the MSA, and the MSA, we've been able to demonstrate that one treatment with the QRS prior to, if you do the MSA before you you treat with the QRS and then you do the MSA afterwards, you find a significant cleansing of the superficial layers of the acupuncture system with just 1 8-minute treatment of the QRS. So by increasing the level of energy in the system, the acupuncture system, or I call it the elan vital, some people call it chi, some people call it ki, some people call it prana,